Now for the last question. And John, I was even stunned a little bit when I saw those numbers that indicate the extent to which Democrats versus Republicans favor and Republicans do not favor some sort of universal health insurance or universal health coverage. So I dug a little deeper into the crosstabs which your office provided. The differences are real. In part, I would argue that they're real not on as sort of an index of compassion, but in part at least as an index to efficacy. In other words, I think that Republicans should get credit for actually driving forward a Medicare prescription drug bill that provides prescription drugs for people in the Medicare program. I think, though, that they look at even that program, which I think has been more successful than many people thought, and some Republicans worry about whether the greater role in government is going to be effective or not. I also think there's a lot to be learned and understood behind this whole question of what is really health coverage for everyone. Actually, it's something I favor, so I speak from the standpoint of thinking it's a good public policy. And for some reasons that I think are in your data, I think it's going to be the public policy that the next administration pursues, whether it's a woman or a man standing on the stage in 2009 at the inaugural address. I think when they talk about health care, she or he will talk about universal health care coverage. And the reason for that, not to get political, but just from a political perspective for a minute, the reason for that is the attitudes of liberals who drive on the Democratic side that number up, and conservatives on the Republican side who drive it down, aren't really all that relevant. Now that doesn't mean that liberals and conservatives aren't relevant, except when you think about a candidate for public office, the voter they're looking for is the undecided or the moderate, the voter that's in that swing range. And what's interesting and I think very instructive about the Zogby survey is in the discussion about whether or not government should ensure that every person has health coverage, 53% overall said yes. So then what you explore is, well, who's above that and who's below that? Hispanics are 70% yes. Hispanics, 70% yes. And there'll be a real push by both parties to attract Hispanics. So the Republican who's going to oppose some sort of health insurance coverage for all is going to fly right in the face of 70% of the Hispanic population. Females, 63%, 10 points over the average, 63% say yes. And I guarantee you that Republican candidates are going to be working hard to attract female voters. John gave his definition of who's a liberal. I'm not sure I'd call him a liberal, but clearly the Democratic Party is weighted towards union membership. 85% of union membership, by the way. Remember, 53% is the national average. 85% said that government should ensure every person has health coverage. The one that I was particularly interested in, though, has to do with where liberals, moderates, and conservatives come out. And conservatives are, in terms of being willing to pay higher taxes, the average was 42%. Liberals were at 83%, but moderates were at 53%. And again, I submit that I think in the political dialogue today, those who simply don't believe government should have a role here are probably going to lose out because I think each major candidate will be looking for how to bring that swing voter to them. And as you look at this survey, there's a lot to make you believe that in fact the swing voters are going to be looking for some kind of a national health care solution. It's not going to be a health care program run by the government, but it probably will be something patterned a little bit after what was done in Medicare, where the private sector plays a major role and where everybody has some form of coverage. Particularly topical in a day when the president vetoed the chip program for young people, and I would speculate that some of this data suggests that while the Senate probably can override his veto, the House does not yet have the numbers, but they may get there because I think Republicans will be very concerned about what they'll do to those moderate voters. Thank you very much.
With regard to prevention and individual responsibility, I'm wondering if you have any models where that has actually worked effectively. I mean, it sounds wonderful. It sounds like a silver bullet potentially, but can we look to any place, either in the United States or outside of the United States, where we've seen effective implementation of programs like that?
Great question. I don't know. Do you?
I assume you're talking about prevention overall. I think it's more useful to talk about it in terms of individual health behaviors. And yeah, and think about, it wasn't all that long ago that many people, including, we'd be sitting here in this room and many people would be smoking. We turned that around in this country over the course of generations, but it was a combination of public policy, first the science that demonstrated the risk, and then public policy, and then how to help people who realized it would be healthy for them to quit actually do so. And the same things is true for seat belts. An example, if research pays off, now we take it for granted that it's important to wear a seat belt, or for putting babies on their backs to sleep. It wasn't always like that. And we can do more in terms of pushing the adoption of healthy behaviors in this country. It has been. The history is it's a combination of public policy and incentives for making changes, for behavior change, and help in making behavior change happen.
One clear, important factor in that is access to a health professional. And it was very interesting 2 or 3 years ago when I went through Canada visiting pharmacies. Virtually every pharmacy had a physician's office attached to the pharmacy or within the pharmacy. Virtually every pharmacy had multitudes of testing, that kind of thing going on. The access was phenomenal. Now, I know there's a number of physicians that are going to be part of this program, and you can challenge this anytime, privately or publicly, if you will. But these clinics inside the retail setting are an interesting phenomenon driven by the demand of the consumer for access to a medical professional. And I'm the first to say that a nurse practitioner cannot provide all of the services that a general practitioner or a physician can provide in a physician's office. But for many people, bringing their child to a medical professional when they need that help at 7 o'clock or 8 o'clock at night when they get home from work, that mother, head of household, is going to go to a pharmacy where there is one of these clinics. And Walgreens just announced, I think they're going to have 400 more clinics next year. CVS liked Minute Clinic so much, which they allowed to come into their stores, they bought the company, which tells you the kind of demand they see there. So I think we're going to see more access, and it's a whole other topic, but this whole question of people doing their own medical research online is a remarkable phenomenon that I think is going to change things in this country.
I was standing in line at the drugstore picking up medications. This is about a year ago now. There was a woman ahead of me with a walker who was well into her 80s arguing with a pharmacist. And the pharmacist says, look, I have information right here. And the woman said, but I downloaded this just a couple of hours ago. People are empowered, and people will make sacrifices if there's leadership, and they're asked to do so. There was a question way back, and then you, sir.
Oh, yes. Let's drill down to the economics of what you started with, the sick care versus the health maintenance. What is it that's, in your opinion, that's so taboo to the capitalist about the notion of a future of health maintenance versus what the old god is of health care? I mean, help me to understand what the concern is about the capitalism of that.
Old habits die hard. I think there's a lot of different things going on, including the who gets to go first. If it's perceived that you might reap a short-term competitive disadvantage as a corporation to invest in prevention and wellness for your employees, short-term. I said, if you're going to reap a disadvantage or feel a disadvantage, you're less likely to move ahead. But if everybody takes the pledge together, if you will, and there's public pressure as well as enlightened leadership by